So I saw this pop up on RNZ today. Staff shortages, nurses afraid to come to work at Canterbury's mental health services review finds. And then TVNZ featured it. It's only a 3-minute story. It's a big story. It's about what's happening. We're hearing about, nursing shortages, and there's no hiring freeze. We let them hire 3 people when they need 60. So I thought to wrap up the show tonight, maybe we'll just have a look at this inquiry, finding significant problems in Canterbury's mental health services. And like I said, what catches your eye, nurses afraid to come to work because they're not feeling safe. So let's have a look what happened on what was reported on One News tonight.
Critical staff shortages were among multiple failings detailed in a damning report into Canterbury Mental Health Services 3 years after the murder of Laisa Waka. The mother of 4 was killed by a mental health patient who was out on leave from Hillmorton Hospital. Lisa Davies reports.
Laisa Waka was stabbed to death in this Christchurch street.
Her life was taken far too soon in a violent, malicious manner. For no reason.
Her family given the scathing report listing failings in mental health services that allowed her killer to leave the confines of Hillmorton Hospital.
We gave our heartfelt apologies for these tragic events and expressed our sorrow for what had happened to them.
The impact of meeting them apparent today.
What an incredible, courageous family they are and the journey they are going through.
It is good to see genuine attrition, genuine remorse for the involvement that the group that you're running. And I'm not going to go, but fuck him. It does make me think though again, and I know we can't have a result of legal action like they have in America unless you have the whole American society here, which we don't want. But these are those instances where I go, ACC, that kind of stuff, it's not enough. It's not enough. There should be able to be some recourse. That daughter who we just saw who lost her mum looked young, lost someone who would help her through university, work with kids. There could, and I'm not ever saying obviously that a financial or remuneration amount is worth a life, but what we can do is figure out a way to make that person's life easier as they go on without the other person whose death is in part at the fault of this government organisation. I'm saying all those things in part, some part, because not 100%. You know what I mean, Chewie?
Yeah, absolutely.
Yeah. Maybe there needs to be a middle ground between ACC and a litigious society, but it seems to be that thing is we gave up our right to sue for this ACC thing, but ACC doesn't quite provide well enough to leave people short all the time. And yet we can't do the other thing. Maybe there needs to be some kind of tweaking of that system, either more into the ACC system or maybe circumstances where maybe it would just be when government or business offends against you, there is an open portal for financial remuneration there or financial recompense or something like that. I don't know.
Yeah.
We acknowledge that we have some work to do.
The family of 83-year-old Faye Phelps, murdered in her garden last year by another of the hospital's mental health patients, also acknowledged.
Health New Zealand accepts that we have made some failures.
The report found there was heightened demand due to the Canterbury earthquakes, mosque shootings and a rapid increase in the prison population, and made 9 key findings.
Critical staff shortages, poor morale, disruption and delays in resourcing decisions, these contributed to pressures.
The result, employees scared to go to work. The events forcing improvements. There are now 11% more staff in the forensic psychiatry area. The report makes 18 recommendations to make the service safe for patients, staff and the community, including improving governance, performance and decision-making, reviewing the care model and improving resourcing. From next week, all patients under the Mental Health Act at Hillmorton's Forensic Unit will have to have their leave requests reviewed by the Director of Mental Health. The continued implementation of other changes to ensure immediate safety will be monitored closely for a year.
I'm not prepared to just sit there and say one and done. That's why I'm doing the monitoring program, to make sure that they are embedded.
I made it very clear to Health New Zealand, they need to assure public safety while those recommendations are being implemented.
To ensure nothing like this can happen again.
Keep on asking myself why. Why have I lost the love of my life?
The love of his life lost to a broken mental health system. Lisa Davies, One News.
When you hear it explained like that, lost to a mental health system, I mean, the reporter, Lisa Davies, is putting all of the blame on the government department. So, you know, I know there's no point debating that because it's not the way the system's run, but it feels like there needs to be a middle ground to me.
I mean, Minister Ducey, I think I'm pronouncing that right, saying that I've passed on my expectations that this isn't going to happen again, is just is there something less than this is literally the least I can do?
Well, the other thing is he's talking about back office people. It's the back office people that would keep an eye on some of these things and make sure things are going on. You know, like, for example, monitoring the cameras. And they're taking all the money out of the back office people.
So he's shat out an email, sent it to probably an unmonitored email address, or it prints out of a printer in an unintended office, and nothing happens. Nothing changes. Like, this is where I get really shitty with a short-term thinking government, like National tends to be. Like, Christchurch has been through it. You know, when you hear it laid out, earthquake, mosque shooting, overcrowded prisons. Like, anybody could have seen that what Christchurch has been going through would have had downstream effects. And yet, we are back into, we don't give enough money to these things. We don't have enough staff. You know, I saw last week that you read out that email from a nurse explaining what her day-to-day is. Right? And that cut straight through me. Obviously, my sister's a nurse. Right. She's told me very similar situations. In fact, I was wondering if that email was from one of her colleagues.
That TikTok's currently at nearly 8,000 views because I put that up on TikTok. So yeah,
it's such an important piece.
Yeah.
Find it, share it around. It's so important. We know what the problem is. More importantly, the government knows what the problem is. They're really good at identifying what the problem is. And the problem is not enough money, not enough people. And their solution of cutting even more money and getting rid of more people is not going to solve the problem. Why do we have to relearn this every 8 years? In possibly the least efficient way possible.
Yeah.
Like, do you get to a point as a politician where you can see the testimony of someone there going, why is my mum dead? Why is the love of my life dead? And then the report in the inquiry says, actually, fuck, it's all our fault. And you're the minister in charge of that. Does that not affect you? Like, I know you didn't deliberately go and get this guy out and point her at it, but this is part of the thing of being a leader, right? And especially as a member of government, your only job is to protect the people. That should be number one. Protect the people that are having to be in that mental health situation, protect the people that work in it, and protect the general public. Do that. I don't care about the budget. I don't care about all of these less concrete things about how much tax you're paying. You know, we've got to deliver tax cuts. Fuck off. People are dead. People are dead, and the people that are in there trying to help people are creaking at the seams. And again, more hand-wringing from the government. Oh, well, we just can't fucking blah, blah, blah.